Imagine waking up every single morning, looking down at your stomach, and not recognizing your own body. You're doing everything right. You're active every day. You can barely eat because of your medications, and yet the scale keeps climbing. 30 pounds gained since giving birth, and your belly is so swollen, so hard, so uncomfortably tight that even drinking a glass of water feels like your skin might split open. Doctors keep running labs. Labs keep coming back mostly normal. And the only suggestion your primary care physician can offer is, well, you could try a weight loss injection if you want to pay out of pocket. That's it. That's the medical advice. For a young mother of 2 who is breastfeeding, recovering from a second C-section, managing endometriosis, and dealing with a stomach so distended it's physically painful, if you've ever felt dismissed, confused, and completely alone in your own body, stay with me. Because what this woman went through is more common than most doctors will admit, and the answers hiding inside her story could genuinely change the way you understand your own health. Let's set the scene so you fully understand what we're dealing with here, because this is not a simple story about postpartum weight gain. This is a 34-year-old woman with a genuinely complex medical history. She's had 2 C-sections, the first in 2021, the second in late 2024. She has a formal diagnosis of endometriosis, which, for those who don't know, is a condition where tissue similar to the lining of the uterus grows outside of it, causing inflammation, pain, and all kinds of systemic chaos throughout the body. She also has what's called a chocolate cyst on her right ovary. That's a type of cyst filled with old menstrual blood, and it's directly associated with endometriosis. She is currently breastfeeding her infant. And on top of all of that, she is managing her mental health with a stack of medications, including Wellbutrin, Lamictal, Adderall XR, Adderall IR, Prozac at 40 milligrams, and until recently, 5 milligrams of Abilify, which she stopped about a month before posting her story. This is a woman whose body is under enormous physiological stress from multiple directions at once. And yet the bloating, the weight gain, the discomfort, it was being treated as if it were simply a lifestyle problem. That framing is not just frustrating, it's potentially dangerous. Now let's walk through exactly what she's been experiencing, because the details here matter enormously. The bloating started around 6 months postpartum after her second C-section, not immediately after delivery, 6 months in. That timing is a critical detail we're going to come back to. The swelling in her abdomen is severe and constant. It's not the kind of bloating that comes and goes after a big meal. It is there when she wakes up. It is there when she goes to bed. Even water, plain water, makes her feel like her stomach is going to burst. She describes it as firm to the touch, not soft, not squishy, firm. And she says sucking her stomach in feels like a literal physical chore, like her muscles are fighting against something. Here's what makes her story particularly puzzling on the surface. She has no constipation, she has no stomach aches in the traditional sense. Her bowel movements seem to be functioning. So the immediate, easy answers, it's just gas, it's just constipation, it's just diet, don't apply here. This is something else. She's also heavier now than she was the day she gave birth. Think about that for a second. Most women, even accounting for postpartum hormonal shifts and breastfeeding hunger, don't gain 30 pounds in the months after delivery when they're barely able to eat due to their medications. She explicitly says she can hardly eat because the medications suppress her appetite and she gets full and bloated almost instantly. So she's not overeating. She's actually undereating relative to what a breastfeeding mother typically needs, and she's physically active every single day, and she's still gaining weight, specifically all of it in her stomach. There are several things happening here that deserve serious medical investigation, and I want to walk through each one because this story is really a masterclass in how complex women's health can be when multiple systems are involved simultaneously. The first thing worth examining is the medication picture. Abilify, the antipsychotic she recently stopped, is well documented for causing significant weight gain, particularly abdominal weight gain, and it can also cause metabolic changes that linger even after discontinuation. But here's the other side of that coin. Stopping Abilify can also cause what's sometimes called discontinuation syndrome, And some people experience paradoxical changes in water retention and metabolism when coming off antipsychotics. Combined with Prozac, Wellbutrin, Lamictal, and 2 forms of Adderall, her entire hormonal and metabolic signaling system is being influenced in multiple directions at once. This doesn't mean her medications are wrong. They may be absolutely necessary for her mental health. But it does mean her body's weight regulation systems are not operating under normal conditions. The second massive factor here is her endometriosis and the chocolate cyst. Endometriosis is a systemic inflammatory disease. It doesn't just affect the reproductive organs. It affects the entire body, including the gut, the lymphatic system, and the immune response. Endometriosis-related bloating, sometimes called endobelly, is a recognized phenomenon where the inflammation caused by endometrial lesions creates severe, visible abdominal distension that has nothing to do with food or digestion in the traditional sense. It can make a person look and feel visibly pregnant. The fact that her bloating is firm, constant, and located specifically in the abdomen, while her period has always been irregular and extremely heavy and painful, is completely consistent with this picture. And her chocolate cyst on the right ovary? That's not a benign footnote. Chocolate cysts can grow, rupture, and they're a marker of more extensive endometriosis involvement. The third element is the C-section history and the muscle repair. Her OB repaired her abdominal muscles during her second C-section. After any abdominal surgery, but especially a second one in the same location, there can be adhesions, internal scar tissue, that form between organs and the abdominal wall. These adhesions can restrict movement, trap fluid, affect how the intestines function, and cause exactly the kind of firm, uncomfortable fullness she's describing. This is not hypothetical. Post-surgical adhesions are a real and often underdiagnosed cause of chronic abdominal symptoms. The fourth element that cannot be overlooked is her consistently abnormal urine labs. She mentions that her urine labs always come back abnormal. Always. And yet this doesn't seem to have triggered aggressive follow-up. Abnormal urine labs alongside swelling, headaches, fast heart rate, and rapid unexplained weight gain are a combination that should be prompting a conversation about kidney function, lymphatic involvement, or even something like POTS, postural orthostatic tachycardia syndrome, which can cause fluid retention, fast heart rate, and a range of seemingly unrelated symptoms. The swollen lymph nodes in her armpits add another layer of concern that suggests her immune and lymphatic systems are under stress. And then there's the breastfeeding dimension. Prolactin, the hormone that drives milk production, can affect cortisol levels, thyroid function, and water retention. It is entirely possible for breastfeeding to contribute to fluid retention, particularly in the abdominal region, especially when combined with the inflammatory load of endometriosis and the metabolic effects of her medications. The fact that she's holding weight specifically in her stomach rather than all over her body is actually a clue. Diffuse weight gain looks different than localized abdominal swelling. Hers sounds like the latter. So what can you learn from her experience? What can you actually do if you're in a similar situation? First, advocate for imaging, not just blood labs. Abdominal ultrasound, pelvic MRI, and ideally a laparoscopy consultation with an endometriosis specialist, not just a general OBGYN. General OBs often underestimate the extent of endo. Board-certified endometriosis excision surgeons see cases every week that were dismissed for years as normal. Second, ask specifically about adhesions. If you've had abdominal surgery and you have unexplained firm bloating, find a surgeon who specializes in adhesion-related complications and ask directly. Third, don't let abnormal labs go unexplained. If your urine labs are consistently flagged, push for nephrology or urology referral. Mostly normal is not the same as fully normal, and patterns matter. Fourth, research endobelly and talk to a gynecologist who takes it seriously. The connection between endometriosis and gut symptoms is real, documented, and frequently missed. Fifth, if your heart rate is consistently fast, you're retaining fluid, and you're having headaches, ask your doctor to evaluate you for dysautonomia or POTS. These conditions disproportionately affect women and are dramatically underdiagnosed. This woman is not lazy. She is not exaggerating. She is not simply dealing with normal postpartum changes. Her body is sending signals from multiple systems simultaneously, and those signals deserve to be heard by someone who will actually listen and investigate. If this sounds like something you or someone you love has experienced, unexplained weight gain, bloating that won't quit, symptoms that don't fit neatly into one diagnosis, and doctors who keep telling you everything looks fine, share this video. Someone in your life needs to hear it. And if you want more stories like this one, real health experiences that go beneath the surface and actually break down what might be happening, subscribe to this channel. We dig into the health questions that aren't getting answered anywhere else. You deserve real answers. Let's find them together.